The world of personal development has exploded. There's a lot of coaches, a lot of mindset coaches, a lot of positive speakers who really try to get you to really realize your potential. If you think it, you can do it. The power of habits, the power of positive thinking. I believe in all this, and I enrolled in coaching with Lewis House and with Brendan Burchard. Shout out to both of those guys. They're amazing. But the point that's missing is that biology affects psychology. When I went to talk to a lot of the women I was with, they keep telling me, I keep coming to those meetings. I want to be great. I'm trying, but I don't know. When I get back home, I'm tired. I have brain fog. I'm exhausted. I can't get to it. It's their biology that's lacking. It's because they may have hormonal imbalance that they cannot be great. They're trying, but they're limited by biology. There's a bidirectional influence. Biology affects mindsets or psychology, but psychology or mindset also affects biology. They go back and forth. But you have to remember that we are made of trillions of cells. The human being or any organism, it's a collection of cells. And then you go on top and then you put psychology. Because think about it. If somebody's dealing with severe thyroid deficiency, you can't think straight. Your neurons, your brain cells are not firing the right way. You don't have the right energy. Your mitochondria are not working the right way. If your mitochondria are not working, your hormones are not optimized. Once you see that you cannot be your best self, cannot be great, before you start saying and internalizing, I just can't do it. I'm just weak. I'm just flawed. Check your biology and optimize your biology. Most likely you'll see that you'll be able to go further.
Welcome back to the Best Life Code with Dr. Rudy. Dr. Rudy, how are you?
Doing great. Always excited to be here. Vivek, this is episode number what now?
20th.
20th. That is amazing. I went to a conference this weekend and I had a few people who told me, I've seen your podcast. Feels so great to see that and to see all the downloads. So eternally grateful for all the listeners.
Yeah, absolutely. And this week special in not just for our, where we rank, but this time we are ranked in Japan this week. So new entry.
Look at this.
Yeah. I love to see every time something top 20 new chart. I was like, all right, great.
In a new country. That's amazing. So that means that what we're discussing, Vivek, has carries a lot of weight. So I'm humbled and excited about this.
Yeah. And this one is a very special one, especially because it's something something you are building for several years. I think finally you're ready to take it out. So I'm going to do this expose right now and say, today we are going to talk about the biology of greatness. And Dr. Rudy, first up, tell us, what do you mean by that?
So the biology of greatness. So it's something that came out of me and I got inspired. First, I want to give credit to Lewis House. So Lewis House has an amazing podcast. And I went to his conference, the Summit of Greatness. And he has a book, The School of Greatness. So Lewis House is a personal development coach, a high performance coach who has an amazing podcast. And when I went to his conference, something dawned on me. I realized it, right? What I mean by biology of greatness is at the end of the day, what do we all want? Is to be great, to be the best version of ourselves, to achieve self-actualization, like Maslow said. But how do you get there? So the world of personal development has exploded. There's a lot of coaches, a lot of mindset coaches, a lot of positive speakers who really try to get you to really realize your potential. If you think it, you can do it. The power of habits, the power of positive thinking. I believe in all this. And I enrolled in coaching with Lewis House and with Brendan Burchard. Shout out to both of those guys. They're amazing. But the point that's missing is that biology affects psychology. The better you feel, the better you can achieve. So the dawning came on me as I was in the meeting with Lewis House at the Summit of Greatness. And one of the female presenters that was there, she's an amazing presenter. She's a spiritual teacher. Her name is Gabby Bernstein. And while she was giving a beautiful speech on how you can transcend any limitations that your mind has if you just apply yourself, think positive, connect with spirits, and you can really achieve anything you want. But she also said, ladies, I'm all patched up. What she meant by that is she's in her mid-40s and that she's using estrogen patch because of her hormonal imbalance. Most of the women that were in their mid-40s or 50s in the audience did not get it. When I went to talk to a lot of the women I was with, they keep telling me, I keep coming to those meetings. I want to be I want to be great. I'm trying, but I don't know. When I get back home, I'm tired. I have brain fog. I'm exhausted. I can get to it. It's their biology that's lacking. It's because they may have hormonal imbalance that they cannot be great. They're trying, but they're limited by biology. Even Gabby Bernstein, who's a top motivational speaker, top spiritual advisor, needed hormone therapy to be the greatest version of herself. So it dawned on me. We need to talk about the biology of greatness. We need to let people know that biology really helps you go further. And when you're young, you may not feel it. When you're 22, 25, 28, your hormones are their best. If you're healthy, you have good biological optimization. Do you remember those years, Vivek? For
Yes.
you, it's not that long ago, right?
It's still long ago, but
I'm
yeah.
thinking about my years when I was, again, not early 20s, mid 20s, 25, 27, 28. I was always healthy, working out, but my brain worked great. My physical body recovered. I could go out to the club, party all night, get up, go to the hospital the next day, take an exam the day after that. I recovered easy. I was top performance on my body. As I got older, I realized those things became harder to do. I became limited by my biology. And I want to be the doctor who can bridge the personal development world with the functional medicine world. Because when we can be our best is when biology and mindset are optimized.
Yeah. I think it's also, I guess I would just add this or ask you this, that isn't it like we talk about mindset a lot and we say like mindset is what drives your just like success more than your body. So I guess it becomes like what I just want to press on the point that you said that a lot of it is the body gets old and it will get old, yes, but by having those things, the biology right, keeps your mind sharp, keeps your mindset sharp, and keeps your growth trajectory moving. Is that
Yeah.
where you're trying to take this? Is that how you view the world?
Yeah, and there's a bidirectional influence. Biology affects mindsets or psychology, but psychology or mindset also affects biology. They go back and forth. But you have to remember that we are made of trillions of cells. The human being or any organism, it's a collection of cells. The way the cells function, it's biology. And the way your cells function will affect the way your psychology works. So at the end of the day, if we were to do a pyramid again, and I was to put what's the most important at the base, it's your biology. And then you go on top and then you put psychology. Because think about it. If somebody's dealing with severe thyroid deficiency, you can't think straight. Your neurons, your brain cells are not firing the right way. You don't have the right energy. Your mitochondria are not working the right way. If your mitochondria are not working, your hormones are not optimized. You can't think your best. You can't be your best version of yourself. So now when you have all those, the base of that triangle, the base of it, you have good biology, then of course your psychology is easier to achieve. So that's what I want to bring to people because I've met many people at those personal development summits that will tell you, I try. When I'm at those meetings, I'm excited. I want to do it. Then I get back home. I'm tired. I'm not sleeping well. I have brain fog. Of course, life gets busy. That's another thing. But biologically, they're limited. It's like, something I like to say. It's like you're in a race, but you have a flat tire. Your biology is the flat tire. Your mindset will keep going. Although you have the flat tire, you hear that noise, it's going slower. And that's, again, the power of the human spirit. Some people can overcome their biological limitations and still perform. But when you optimize their biology, they didn't even know they could perform that much better. So the same way, you have a car that has a flat tire that's still going somewhat. And the person is like, I'm going, I'm trying. You come in, you change that flat tire, you fix that flat tire. How fast is that car going now?
Yeah. It's, you know, we talk about ambition, confidence, resilience, right? So let's start with the big three: dopamine, testosterone, and cortisol. How do they work together to or against these
Yeah.
things?
So the way we're going to talk about those different molecules in groups. So the first thing we're going to do, let's talk about thyroid hormones, because thyroid hormones are the master regulators of your metabolism. Actually, if your thyroid is too slow, you can die from this. This is not the other ones like testosterone. And if you have zero testosterone, very low testosterone, you're not going to die. But I have seen patients in the hospital that came with very low thyroid hormones and they had congestive heart failure, abnormal rhythms of the heart, and you can die from this because thyroid are the master regulators of our metabolism and play a role in almost every metabolic function in the world. So, in thyroid disease, especially hypothyroidism, when you don't have enough thyroid hormones, is very common. Most particularly, this form of low thyroid we call Hashimoto's hypothyroidism. This is when you have an autoimmune reaction to your thyroid, and your body just doesn't produce enough thyroid medication because of inflammation. But when you have low thyroid, the main symptoms are extreme fatigue, low motivation, and brain fog. You can't think straight. So if I give somebody this and I tell them, go and be the best version of yourself, go learn this, go and be resilient, it's difficult. Not because they're weak of character, because their biology is not optimized. And you take that same person, you give them medication, you restore their thyroid function, they become self motivated, they become more sharp. So I used to think that character and personality was set, that you were either motivated or you were not. You either had self motivation or you did not. It is biologically influenced. So that same patient who had low thyroid, when I fix their thyroid issues, it is much easier for them to do the things they know they should do.
Yeah.
So thyroid is one of the main ones because it's very common. It affects a lot of patients. It's easy to fix, and it affects our motivation, our resilience, and our energy and vitality.
And of course, mindset, right? Mindset is also limited by things like hormone imbalances, right?
Yeah. So
And
now let's talk about hormones, what we call the sex hormones, things like testosterone, estrogen, and progesterone. And this is the one that is the most known, and this is the one that happens as you age, right? We've talked about low testosterone. The main symptoms of low testosterone in men and also in women, it's decreased motivation, decreased desire to do things, to achieve. They've done even animal studies where they saw that animals who had lower testosterone levels did not want to go higher in their social rank. They were okay where they were. So it's motivation. It's also for vitality, energy, muscle mass. So it's the same thing. I see that a lot in my practice. I do a lot of men's health, and now I see a lot of younger men with low testosterone in their 30s, 40s, and 50s. And I'll see a patient come to me, and I had one the other day. He was a lawyer. He was in his early 30s. And then he came to me. He was like, Doc, I'm tired. I've lost my motivation. He's a corporate lawyer who's had a corporate job, very long hours, working. He didn't take care of himself, kind of gained weight, didn't lift weights. When I checked his numbers, his testosterone was very low. Very common scenario. And he's like, yes, I've taken all the classes, the seminars. I know what I should do. I just don't have the bandwidth, those were his words, to do it. When I checked his levels, in this particular case, his testosterone level was low. For whatever reason, right? I'm not going to go over the whole case. But after discussing with him, we did informed consent, I replaced his testosterone. Within 6 weeks, he told me, I'm back to my proactive self. Because imagine he's a corporate lawyer, got really high in his position. You have to be a type A personality to get there. He told me I was a shadow of myself without testosterone, and testosterone restored this. So what was the other option on that patient? And that's what was happening with him. He kept going to his doctors. He was like, I'm tired. They was like, oh, you're stressed. He did coaching. They told him, come on, try better, do better, think more positive. You can't outthink low testosterone. You cannot out positive thinking your way out of hormonal imbalance. Now, when you replace the hormones, it's easier to have that positive mindset, and it feeds on this. Because at the end, after that, we're going to talk about how psychology can improve your biology. There's no questions about it. Mind over matter, but matter trumps mind.
Now, we know there are biological difference between men and women. Now, the question is, would this also cause difference in motivation and performance between men and women?
Yeah, and men, in a sense, are biologically simple because we only have mostly testosterone. That's the main hormone for men, the main sexual sex hormone. Women have three different hormones. They have estrogen, progesterone, and testosterone. And women actually experience menopause, which is when menopause is basically when those three hormones stop being produced in the body. And women experience perimenopause that can be 10 years before that, where the levels start going down, they fluctuate. And if you ask a woman who's going through perimenopause, they will tell you it is life changing. It is personality changing. Some women don't know what's happening to their body and their brain. And they see, what is this? So remember, I did a corporate wellness talk with a bank talking about executives. Though there were a lot of women executives, a few men also, but they were in their mid 40s. Not more than 75% of them said they wanted to either retire or take a lower position because they felt like they no longer had the focus or the brain power to do their high level jobs. Hormones play a role in this. And if you balance the hormones, the executive can function better. So you're looking at a woman going through perimenopause. One of the main symptoms is brain fog. One of the main symptoms is fatigue. How can you ask a woman that had balanced hormone, balanced biology in her 30s, now she's mid to late 40s, she has hormone imbalance and her personality changes. Her intellect and her cognitive abilities change because of hormone. You cannot outthink this. You cannot out positive thinking this. Oprah Winfrey did a really good job talking about this because she went through it herself. And she really did a great podcast. More recently, Halle Berry has been talking a lot about this because Halle Berry was diagnosed for the 5 years with severe anxiety, and it was perimenopause. So how can a woman go to severe anxiety and maintain their greatness, right? So now you need the right clinician to come in and be like, at your age, let me do your labs. There could be a biological reason for this. So as we're still working on your psychology, let's optimize your biology.
I also read this. I don't know if it's true or not. I would ask you, women's monthly estrogen peaks. Once a month, it peaks. And that's also the time considered you have higher verbal fluency and creativity. Is that true?
100%. So estradiol is the estrogen, and more specifically, estradiol is the one of the most psychoactive hormones, influences the brain a lot. So when you have that peak of estrogen, a lot of women will describe that. And the opposite is true. When women go through menopause and their estrogen level drops off considerably, symptoms are brain fog, brain atrophy, what we call neutropenia, a decrease in the brain mass, decrease in brain connection. You put those women back on estrogen, they'll tell you, you gave me my mind back, you gave me my intellect back. So again, thinking that intelligence, self-motivation was set in stone, it's either you have it or you don't. They're biologically influenced. So any listeners listening to this, if you've been trying to be the best version of yourself, to be great, if you're trying to achieve something, but you feel like you're hitting a wall, check your biology. Find a provider that knows how to interpret those numbers and can really look at this. And if there's any insufficiency, You need to optimize. Because that's the thing also. Sometimes doctors think very black and white, right? There's a red line. If your hormones are not below that line, you don't need to replace it. Doesn't make sense, right? Let me give you an example with men and testosterone. Normal testosterone is 300 to 1200. When testosterone gets to the 400, high 300, you didn't cross the red line of the 300, so you're not technically diagnosed with low testosterone, but you've lost 75% of your juice. And if symptomatically you have symptoms, I want to put your numbers back into the upper quartile, not the lower quartile. And that works for almost every hormone. Thyroid is the same. If your thyroid production is at the lower quartile, you would do better cognitively on the upper quartile. If your estrogen levels drop into the lower levels, you want to put at the upper quartile of a normal premenopausal woman.
Let's talk about neurotransmitters now, because the role of the brain is so important. The brain chemicals, serotonin, dopamine, how much role they play in sustaining greatness and how?
Yeah. So, we've always said that, right? The brain is the CEO of the body. It's where all the executive decisions happen. And the brain is controlled by two different systems, either by hormones or neurotransmitters, things like serotonin, dopamine, GABA. We'll go over that. And also is controlled by electricity, the way the neurons just pass a potential electricity and communicate via almost quantum energy. Amazing. But let's first concentrate on the hormones. Everybody knows about serotonin because they know that's what controls or influences mood a lot. And that's why patients who suffer from depression will take a SSRI, selective serotonin reuptake inhibitor, to increase the level of serotonin in your brain. Same thing. When a patient is going through depression, can they be their best selves? Can they be great? Again, the human spirit can overcome that and still try to achieve despite their biological limitations. But if you can increase their serotonin, they will do better. They'll be able to achieve more. Now, I'm not saying that everybody needs an SSRI. There's other ways to increase serotonin. For example, gut health. Did you know, Vivek, that more than 90% of the serotonin in the brain is made in the gut? So strongly influenced by our diet, our gut health. So a lot of patients, now integrative psychiatrists are doing this. Before they put patients on antidepressant medication, they do gut restoration. And a lot of those patients improve. And if they don't, you can consider whether you should do medication. So serotonin, good, big for mood. Dopamine, really important. We're always looking for that dopamine hit. We get the quick dopamine hits. But once you get that too much, your body becomes dependent. Your reward centers become hijacked. That's why, like you do things like mindfulness, meditation. You do a lot of those things to kind of restore the neurotransmitter balance. But neurotransmitters have a direct and significant impact on how great we can be. If you're depressed, if you have low mood, low resilience, it's hard to achieve greatness. But if I come and optimize your neurotransmitters, it's easier to achieve greatness.
And now the other way around, we talk about...
Hold on. So before we go to that way, and another molecule we talk a lot about that many people don't know about is BDNF, brain-derived neurotrophic factor. BDNF is fertilizer for your nerve cells. And your nerve cells are part of the CEO of your brain, your executive function. So what can you do to increase BDNF levels? BDNF makes you great. It's like spinach to Popeye. Because the more brain power you have, the better you do. And let me go over what increases BDNF, and you'll see those are all things that can help you be great. BDNF can be increased by exercise, especially resistance training, sleep. The more deep sleep and the better sleep you have, the more BDNF you have. Learning a new language, playing a musical instrument, hormone balance, all of those medications, testosterone, estrogen, GLP-1 medication, influence your BDNF and increase neuroplasticity. The technology I'm talking about, transcranial magnetic stimulation to the brain area, increases BDNF. And that in turn reduces depression. increases resilience. So there's so much that one can do. Once you see that you cannot be your best self, you cannot be great, before you start saying and internalizing, I just can't do it. I'm just weak. I'm just flawed. Check your biology and optimize your biology. Most likely you'll see that you'll be able to go further.
And of course, I always say like the other way around, right? How the daily habits improve or influence your hormones or your just body in general. So, can you talk about good habits turning into better performance, especially?
So 100%. And remember, when we talk about health, I don't mean everybody needs hormones. What are our pillars of health we always talk about? Good habits, good nutrition, good sleep, good movement, right? Those are the habits that you do every day to optimize your biology. What are the habits you do every day to optimize your psychology? Gratitude, affirmation, positive thinking, meditation, right? All of those things. So before anybody listening to this again, I'm not saying everybody needs hormones, but your daily habits play a role. And your daily habits of nutrition, exercise, and sleep influence your biology and in turn influence your psychology. So your daily habits have a profound impact on your psychology and your mindset, but it's a lot via your biology. Now, of course, the daily habits also wire your brain for positivity and gratitude. That's why what's one of the main things they say out your daily habits, wake up every morning and do your gratitude routine because it kind of sets in your brain and it involves the increase of BDNF and the wiring of gratitude neurons. There are sets of neurons that are social neurons. They are called the von Economo neurons. The more social you are, the stronger those neurons, those brain cells are. Isn't that amazing? So the power of daily habits, I believe in them because they influence a lot your biology that can then influence your psychology.
This was about habits. Now, the same thing, belief and purpose. Can they change hormones?
100%. So now we're looking at the other direction, right? So I said biology affects mindset or psychology. Now let's talk about mindset or psychology influencing biology. And that is well proven, right? When they say positive thinking, you'll see things happen. It's not just woo woo science. It's studies have shown that mindfulness in when you say positive thinking, not a light positive thinking, visualization, affirmation, deep mindfulness can actually switch epigenetics, can switch your genes on and off and express more resilience or less resilience. So that's why you see that really your psychology, our mind can influence our biology. There's no question in this, but only to a certain point. Your psychology cannot restore low testosterone. Your mindset cannot restore abnormal thyroid function. And I do believe in magic. There are some people, and I've seen it in the hospital, I've seen it in my patients, that sometimes the mindset and the visualization can overcome. I call those medical miracles. I can't explain those. A good example is Dr. Joe Dispenza. You know, Dr. Joe Dispenza is a master manifester, a master mind control. And when, I listened to all of his classes, I haven't gone to one of his conferences yet, but he got himself out of a severe accident that he had, and he was able to really, quote unquote, cure himself. And my friend just went to a Joe Dispenza conference, and they have studies that show that your mind can really influence your biology. But at the same time, there's limits to it. I've had a lot of patients that went to Joe Dispenza 5, 6 sessions, 5, 6 conferences, but they were menopausal. They could not influence their estrogen levels. They could not restore their testosterone levels. But what's interesting is those same patients, once I've restored their biology, put them on hormones, they went back and did Joe Dispenza meditation. They went deeper because now biology and psychology were aligned. So there's no question, and we have the studies now to show that our thoughts, our mindsets, our psychology can affect our biology, but only to a certain extent, because that's the trap that some patients find themselves. They keep going to personal development sessions or coaching, and the coaches keep telling them, if you just meditate longer, if you just think more positive, well, that didn't happen because you still have doubts. You have to have no doubts. You have to have a strong mind, and everything will change. I agree and disagree. Your mind can really help change your biology, but we need to realize that as humans made of cells, made of hormones that communicate, the cells communicate via hormones, sometimes there's miscommunication between the cells. And sometimes just the power of a mind cannot change that. And when you optimize and restore biology, it's so much easier for the psychology to go positive. Does that make sense, Vivek?
Yeah. Yeah.
So it's a bidirectional influence. Biology affects psychology, and psychology affects biology. But because we are made of flesh, we're made of cells, I will say that biology trumps psychology, especially as you get older. Because what is aging? Aging is just a decrease of function of our organs. It's wear and tear. It's that our hormones become less efficient. Our machinery becomes less efficient. That's all it means. As you get older, your cells are not as efficient. Our mitochondria are not as efficient at producing energy. They make more waste. What is mitochondrial waste? It's inflammation. As we get older, we get more inflammation. So if a patient has a lot of inflammation, cellular inflammation, it's hard for them to think or achieve the best cognitive function, achieve the best, being their best selves, achieve greatness. But if I can decrease inflammation, improve mitochondrial function, improve hormonal optimization, that person has a better chance of being the best version of themselves.
I guess the key point here is like, there's a reason why everybody is after that fountain of youth, right? because even though both sides feed into each other, both the psychology into biology and biology into psychology, the point of where it's just bringing it back, it is constrained by your biology. On the other side, if your biology is good, then you actually have no constraint. It's just limitless how you can go that far with that hand, right? So
But that's a great point, because I see a lot of patients with great biology, but really bad psychology, right? They don't have the right mindset. They are into victimhood. They're assholes. You can have great biology, but that's where patients with great biology, they take a good coaching class, or they start doing the right psychological work with themselves, and they'll get it quick. So you want to align your biology and your psychology for your best results. So they work together. They are very intertwined, because it's the physical and mental side. It's where we are body and light. So I do believe that our light body can influence our physical body, but our physical body even more influences our light body. And another outlier I'm going to talk, Stephen Hawking. What a brilliant mind, who at the end of his years, his biology was failing him. Not his brain biology, but his physical biology, right? He was restrained to a wheelchair. He could only move with his mouth. He only had control of his mouth. But this guy maintained his brain biology like nobody else. He was still able to come up with amazing theory and physical theories until the end of his life, until he was in a wheelchair. A lot of people, when they have those biological limitations, those physical limitations, their mind doesn't work. So there are outliers of influence. Dr. Joe Dispenza, Steve Hawkins. I've seen medical miracles of people that we said, okay, nothing we can do for you. And we see a change. That's why, for example, there's been multiple studies that show that prayers can affect surgical outcomes. Think about this. And again, that's coming from me, I'm deeply spiritual, but I'm no longer religious, because I don't believe that one group has a special entity that favors them. My God favors whomever matches his energy. And prayer is that you match the divine energy. And they've done surgeries on patients who've had knee operations. And prayers, actually, the people that prayed and had people pray on them, use less pain medication. What's the explanation? The explanation is that the body somehow, with the prayers, which is quantum energy, was able to transform into a biological issue that you are not as sensitive to pain.
Yeah.
Positive mindset improves our biology. Affirmation improves our biology. Actually, they've done studies on monks and experienced meditators. And they've seen that experienced meditators tend to have a thicker cortex in MRI, in brain MRI, which translates into a higher level of BDNF. So again, this is where you can see the brain can influence matter. But that's for the outliers. For the average person like me, who suffered low testosterone at the age of 49, that's when I became more aware of this. When I was in my 30s, even my 30s and early 40s, I was still operating, I would say 90%, 95% of my potential. I was doing great, working 80, 100 hours a week. I had my twins, spending time with them, being able to come up with all kinds of things. But when I turned 48, 49, I was like, what's happening with me? I can't focus as well. I became more irritable. Things, I became, things would bother me much easier. I became more irritable. My personality was changing. I became less patient. And it was low T. Once I replaced testosterone, all of those things change. Why do you think I have so much energy, cognitive energy at 55? I did 3 podcasts today. I saw almost 30 patients today at my weight loss clinic. And I still have the energy. If I wasn't on testosterone, I would not be able to do this. So how could you ask me to be great if my biology was not optimized? So that's the bridge I want to be. I want to bridge the world of functional medicine with the personal development world. They both need each other, but we have to realize for some people, especially as you age and you experience hormonal imbalance, you need that biological optimization for you to really realize greatness.
Yeah. This is only going to get more and more, I would say, as you educate people like you educate the people. Nowadays I've started to see perfume brands that have wording called peptides on it. 10 years ago, that wasn't a thing, right? So now as people, we all got educated on those things. Now we started to talk as a consumer product, peptide, right? So this is how it's going to be happening for brain health the same way as we are optimizing for it. So,
and for biology, let me give you an example. Ibre Gallardo, right?
Yeah.
She did a really good post the other day on LinkedIn. So she said that, and I agree 100%, that we've noticed, the medical community has noticed, that a lot of cases of cancer happen after a big significant event on the woman's life. They go through a divorce, or they lost their loved ones, or they lost their jobs. Then 6 months or 12 months later, diagnosis of cancer happens. What's the link? There's a biological link. Because a significant stressful event like this will increase oxidative stress, increase inflammation. Your body, oxidative stress means your body's oxidizing, it's rusting. There's inflammation, and that can cause an increased incidence of cancer. So she did a really nice post that I commented on LinkedIn, is that a stressful event is linked to increased oxidative stress, can be linked to an increased risk of cancer. And my comment on her post was that it's absolutely true. There's actually a syndrome for the heart called the broken heart syndrome, where they notice, and we don't know why, mostly women, that after they've had a significant negative stressor, which is usually a divorce, that those women would develop heart failure or would have a heart attack with clean arteries. And it was a Japanese doctor who discovered it, called Takatsubo cardiomyopathy. And there's a specific blueprint that you see in the heart, that a part of the heart gets more dilated, but they link that to a high level of stress that gives you that specific phenotype. Again, that's the link where stress or psychology can influence our biology, right? So, and the opposite, like we said, is true. The patients who have great biology usually don't have those bad outcomes. So interesting, right? The bidirectional influence of biology to psychology.
That's what makes it complex and interesting.
Yeah. And it's very complex because the human body and the human brain, the oxidative potential, When you talk about oxidative stress, it's so complex, and it's a biochemical reactions that turn into biology, then turn into psychology. So it's like you need to know all of those different sciences, including physics, to understand the human body. So the more I'm going into this, is the more I'm getting better at understanding that our thoughts are quantum energy, physics, that can affect our biology, hormones. I'm sorry, that can affect, let me start again. Our thoughts is quantum energy that can affect our biology through biochemistry with hormones. And that biology can now affect psychology, thoughts. And then that's the cycle. Thoughts, psychology, to biochemistry, to biology, to chemistry, to physics again. So I studied all of those sciences in pre-med. I didn't know I would need them. So physics, biology, chemistry, and biochemistry, they're all in play in human action. And we need to understand all of those. But because we are made of flesh and we are made of cells, biology is very important. And as we age, our biology falters, our hormones falter. Whew!
This is going to be like I don't know, more and more episodes on this. It's a
Because
big
it
topic.
is a complex subject,
Yeah.
right? A lot of people listening may be like, "Oh my God, it's going too much in science," and I'm trying to simplify a lot of the medical research for anybody to understand. But I still have to use those big words. I still have to use a lot of that medical jargon, and I want people to understand. And my goal through this is to empower people. Anybody listening to me, put that on AI. Go on ChatGPT, put a lot of those things. Because the more you know, the more you will understand that sometimes you not being your best could be a biological limitation. And a lot of times your regular doctor may not know that. Because regular doctors that I used to be, we didn't understand the importance of hormone optimization. And now we always said that because of the toxic world we live in, our hormones are being assaulted. So what used to happen to people late in years, we see that in early age. I'm actually doing a presentation on plastic, on how plastic, they're called endocrine disruptors. Anti-testosterone, phthalates, one of the plastic components, directly decreases our testosterone, whether you've been exposed when you were in the womb or at any time of your life. So plastics cause low testosterone, and now it's estimated that every human, eats about 1 credit card worth of plastic a day. Plastic was found in 100% of all humans and animals that were tested. They found microplastics in the brain, in the blood, in every tissue, including placental, the placenta and umbilical cord blood. There's microplastics everywhere. And microplastics, we know, affect our hormones. So there's another complexity to this, right? When somebody says they develop low testosterone in their mid-30s, why? A lot of patients come like this to me. They're like, I eat healthy, I do everything right. Why did I develop low T? Could it be that you were exposed to plastic at any point during your development? I'm inviting everybody to look at what's called the phthalate syndrome. Phthalate, Phthalaate. It's a component of plastic that has been shown to be a direct testosterone blocker. It creates so much problem. So my goal is to help people that biology can limit your greatness. But if you're aware of this, if you get tested and you get optimized with the right daily habits, nutrition, exercise, sleep, supplements, and when indicated, hormone replacement therapy, you can achieve your greatness.
On that note, we'll finish this episode today. But Dr. Rudy, you have shown us that greatness isn't just about mindset, it is chemistry, it is hormones, it is biology. But the best part is biology is trainable. And
Exactly.
that's the key message here. So, to everyone listening, your body isn't your limitation, it's your instrument. Use it, learn it, fine tune it.
Fine tune it. Fine tune your instrument. Great way to finish that. Because interestingly enough, I got to keep talking. I see so many patients who take care of their car. Like they make sure that their oil change is done. They make sure they have the best spark plugs. They only put the best gas in there. And you see what they are doing? They are eating junk food. They have visceral adipose tissue inflammation. They're not taking the right supplements. Of course, your machinery is not going to be its best. Just like your car. If you didn't change the oil, you gave it like bad gas, you didn't change the spark plugs, it's not going to be a great car. So it's fine tuning your instrument, fine tuning your machinery.
Well, this is the best life code. See you next time. Thank you.
All right. Good one, Vivek. Till next one.